name is Sophia, and today I will be talking about artificial intelligence in imaging. As I said in a previous video, I'm very interested in AI, and radiologists actually use it a lot in their profession. So I'm super excited to show you how they do this and also how it helps them. First of all, what is AI? In simple terms, it is the science of making machines that can think like humans. AI in the general sense is actually not that new in radiology. In fact, CAD, computer-assisted detection, has been used most prominently in mammography for decades in an effort to increase sensitivity in the detection of breast cancer. As you can see from the chart on the left, over here, there are many parts that make up artificial intelligence, including machine learning, a subsystem of AI, making up the largest inner circle and having deep learning, deep reinforcement learning, etc., all underneath it. These terms are often thrown about and used interchangeably when we talk about the AI revolution going on in radiology. However, while overlapping, their meanings and the concepts to which they refer are not actually the same. What is machine learning? Machine learning describes a more general category of computer algorithms that have the ability to self-change or improve their outputs as they are exposed to input data. Deep learning algorithms are a more specific subtype of ML algorithm, particularly based on an information processing architecture employing multi-layer artificial neural networks, ANN. So what is the future of radiology? With the total replacement being unlikely, a more realistic role for AI in the future is as a tool to complement the radiologist's workflow. A radiologist has spent years and years of training to do this job and had to become a doctor first and then an imaging expert. So they know best. The radiologist still has to check the accuracy of the AI interpretation, and I will show you some examples of how AI cannot completely replace the human expert in their fields because AI is not always correct. A program recently approved in the European Union for the interpretation of chest x-rays boasts a sensitivity of 99+% and 0 clinically relevant errors in identifying normal scans, cutting down on radiologist workload. In the United Kingdom, a similar tool was approved on the condition that all results be reviewed by a radiologist. AI may help to liken the role of the radiologist to being a plane's autopilot. For the most part, radiologists welcome the adding tool of AI in their job and helping them to do their profession more efficiently and accurately. So the next time you see a headline proclaiming a new AI tool that reads scans better than radiologists do, just know that it will be a long time before anyone other than a radiologist is doing the final sign-off on those read reports. FDA has approved about 420 algorithms, and about 50 are in use in several hospital institutions. Lots of other things it can detect. The beauty of AI is that these can run all throughout the night, so it helps because this tells radiologists where to look, since there is a radiologist shortage. Machine learning in radiology. Recent innovations in the field of automated diagnostic tools have been made possible by advancements in a specific type of AI called machine learning. This technique involves sending out input data through a neural network, essentially a very complex mathematical function that learns to choose the correct outputs by iteratively modifying itself. A neural network is only as good as the data it was trained on. The way these models are trained means that it can never be said for certain that a neural network is correctly identifying the important features of inputs or merely relying on unseen confounding variables. AI and triaging, or AI helping to determine the urgency of a patient's needs for treatments. These are a few examples of what the AI is used to find in patients and what it prioritizes. I'll talk a little bit about what each one means. Intracranial hemorrhage is bleeding in the brain. Cervical spine fractures are when the neck fractures. In other words, there is broken neck bones. A brain aneurysm is when the artery becomes too dilated and it can rupture. Then it will cause the brain to bleed. Pulmonary embolism is a clot in the lung artery, which can lead to death because it can block oxygen from getting into your body. Aortic dissection. So the aorta is the largest artery in your body, and it's made of multiple circular layers that are walls. And if one of these walls rips, then there can be a flap inside, and it can block and clot. So then the body will get less blood flow, causing parts of your body to die or your entire body to die eventually. Rib fractures are breaking of the rib bone. Intra-abdominal free air is it can be caused by bowel bursting or ruptured. So you have to go into surgery to fix this. Otherwise, you will die, because then there will be all this poo-poo going out of your bowel and into your body, which is infected, and that's very bad because that can lead to your body becoming infected. Pulmonary nodule detection. So the AI helps find these nodules, which are spots in your lungs that could possibly be lung cancer. Tumor growth detection. So tumors are swelling parts of your body which are caused by an abnormal growth of tissue. And so these could be benign, which are not bad and not good at the same time. So that's fine. Or malignant, which is very bad. So the AI helps detect these. Finally, computer-aided detection. So radiologists have been using it for years people have been using it for years in mammography, the study of breast imaging. So it can color code a mass to tell if it's more likely to be benign or malignant on a breast MRI, which is pretty cool. So we will go more into all these terms as we look at a few examples of each. But before we get started, I just wanted to let you all know that there are many types of AI helpers that radiologists use. But today, we will specifically be looking at the one called AI Doc. So, this is an example of an intracranial hemorrhage. As said before, intracranial hemorrhage is the bleeding of the brain. In this CT scan, the AI Doc detected the circle, something that is very small. See here? And that's very helpful to radiologists because it helps them seek what to prioritize and what to check for in patients. C-spine fractures. So similar to the previous scan, AI Doc circled where it thinks the C-spine fracture is. So that's right here. And then a fracture, once again, is when a bone breaks. So on a CT scan, it may look like a crack, similar to the one that you see here. And it's also pretty difficult to find, so the AI Doc was very helpful in finding that for the radiologist to check for. Brain aneurysm. Remember that a brain aneurysm is where the artery becomes too dilated, so it can rupture, and then will make the brain bleed. So the AI Doc, it found that here as this white dot, which was very helpful. Incidental pulmonary embolism. This is where there is a clot in the lung artery, which can lead to death because it can block oxygen from getting into your body. So it's very good that this AI Doc was able to find it. As you can see, right on the right side of the person's body, since the CT scan, remember, flips the right and left side, there's a dot. And instead of being fully white, which is what it's supposed to look like, the dot has a black spot on the inside, which is not normal. And the AI Doc was able to detect that. So that's very good. Aortic dissection. So as I said before, the aorta, the largest artery in your body, it's made up of circular layers, and then one of the walls rips. So there's a little flap, and that's right here, this curve. This is the vessel, and then this is what has clotted off. So there's no flow going into that area, and there's only flow going into this small area. So look how much the artery has clotted. That's a lot. And so that can lead to some major issues in this person's health. So thank goodness that the AI Doc was able to spot this out. Yay! So here we go. This is a very subtle rib fracture or breaking of one of the ribs that was found by AI Doc. Here. This really helped out the radiologist by reducing their read time and helping them prioritize this patient for additional evaluation so that they could go into surgery and get the treatment that they need. Intra-abdominal free air. So this, once again, is when the bowel bursts or ruptures, so the patient must go into surgery to fix it. And in this case, the AI doc found this very tiny dot of air, which was actually caused by appendicitis. So that's like a part of the bowel that was ruptured since it's connected to the cecum. And I talked about this in one of my previous videos, so you should check that out if you want to learn more about appendicitis. So the radiologist found this out, and the patient went straight into appendectomy surgery after the scan. So, yeah, good job, AI doc. So here's another example of where the AI doc flagged an aortic dissection so that the radiologist could prioritize this patient instead of having them as a routine patient, and so that this patient could be read first and receive the appropriate treatment. See, this is the clotted area, and this is the flap. So the vessels are always white, and the clot is this gray part here. Now we will get into some instances where the AI doc is wrong, since it's not completely right all the time. So in our first example, AI detects a pulmonary nodule, which are spots in someone's lungs that could be cancer. It could also possibly be a metastatic nodule, which would be from another cancer that spread, but this is just the right pulmonary artery, so if the patient is completely fine, and this is known as a false positive. If this patient were to go into surgery and get this artery removed, then that would be very bad because the person needs this pulmonary artery to survive. So it's very important that the radiologist check this. This is our second example where AI called this a pulmonary nodule, but it is just the left first costochondral junction, otherwise known as the first rib and cartilage going towards the sternum. Now in this next example, this is where originally AI was very useful because it found this pulmonary nodule right here. So it circled it or pointed it out. And that was cancer in 2017. So the patient was able to get it removed. Yay! But when the patient came back, the AI doc still thought it was a pulmonary nodule, when in reality, it is made of fat and therefore is a benign nodule that is called a hamartoma and is unchanged from 2017. Here, AI called this an intracranial bleed. So it thought that the brain was bleeding. This is wrong because it was actually a tumor, and if the brain were to be actually bleeding, then it would be bright white, like the color of the skull here on the outside of the brain. See, here's the tumor that it thought was an intracranial bleed. In addition, there were more brain masses on this brain CT measured in the green on the scan. So the AI was completely wrong. AI called this a brain bleed when it's actually a right frontal meningioma or a benign brain tumor. So it still needs a radiologist to say if it's right or not because AI got it wrong once again. 3 years later, the AI still called it a brain bleed when it is just a right frontal meningioma, showing that the AI did not learn from its mistake. AI is also useful to pick up on small pulmonary emboli or clots in the lungs, like in this example with the white dot. See how tiny that is? This patient here had narrowing of the right pulmonary artery from masses, but the AI doc thought that it was a pulmonary embolism. To treat pulmonary emboli, you need a blood thinner, but that won't work for pulmonary arteries narrowing from masses. So we want white, like on the left side, but on the right side, the gray stuff is a mass that's squashing the artery. So we should have the patient looking like this on both sides, but there's some gray stuff and that's squashing the artery. so there's less blood flow in the lungs, and this is a tumorous cancer. Here, the AI doc is very helpful because out of all this paraphernalia, which means that so much is going on, it points to this yellow area here, showing the pulmonary embolism, or a blood clot in the pulmonary artery. You can tell when there is a pulmonary embolism because the artery will look like a donut, and it has a central filling defect. And it's kind of hard to see here, but it's kind of gray in this center over here, and it's supposed to be white. The AI doc here called a pulmonary embolism because it thought it saw a filling defect in the body with the gray pushing against the white here. But these are just big masses, so they're like all over the body, and they're these gray blobs here. So there's one here, here. Yeah, see, all over. So here the AI doc is very helpful because it picked up on these small amounts of free air that the arrows are pointing to. And free air, or pneumoperitoneum, is a surgical emergency because it can imply bowel perforation, or like the bowel bursting. And then the bowel contents, like the poo-poo, can spill into the abdomen, causing all that bacteria from the poo-poo to go into the body, and this can cause infection. Here, AI picked up on a subtle brain bleed, and can you guess where that is? It's very small. Here, it's right here. That's so tiny. The AI doc found this tiny brain bleed that's just beneath the skull, and that area is called the subdural area, and a bleed is called a hemorrhage, which is why this is called a left subdural hemorrhage. It's so tiny and a very fatal head injury. So it's very good that the AI doc pointed this out, making it easier for the radiologist to prioritize checking on this so that the patient could get into surgery right away. Here the AI doc pointed to these two rib fractures, so one down here and one up here. And while this one is like kind of obvious because it looks like it's split into two parts, up here this one's way more subtle and it almost looks as if it's being squished. And then here on the right side, there's these three rib fractures, and these are much more apparent since the AI doc made such an interesting 3D model. At the same time though, the AI doc can miss subtle rib fractures as seen here. So it's not always reliable. Here is the rib fracture, and the AI doc said that there were no rib fractures detected. Here the same patient had another rib fracture, and the AI doc could still not detect it. Here the AI doc says that it's an aortic dissection since it saw a line in the aorta, so this is the aorta, which it thought was a flap, but actually it's a pump, and the balloon pump is important because it's given to patients whose heart needs help pumping, so it's good that the radiologist was able to check it. So these are the conclusions of today's video. AI can be useful because it can find small abnormalities that can help the radiologist to zone in on an area to further evaluate. It can help when there's hundreds of studies to be read, so the radiologist can choose which ones to prioritize. Radiologists are not threatened, but welcome AI because it can be very helpful to their job. But at the same time, AI can also cause problems because it can have false positives and false negatives that the radiologists have to be aware about to decipher the actual diagnosis. So, with that, thank you so much for watching this video. I hope you enjoyed it and learned something new, and I'll see you next time. Bye!